Health Spotlight, presented by Community Health Network.
Well, it's time for our Health Spotlight tonight as we welcome in Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. Doc, good to see you. Let's start with that. Yeah, absolutely. Let's start with that huge recommendation about mammograms. A U.S. health panel, as you very well know, says women should start getting the test every other year, beginning at 40 instead of 50. You had a chance to read the report. Your thoughts?
Well, my thoughts are this is going to save lives. We've got new data in that shows that women are getting breast cancer at a younger age. And in particular, we know that Black women, if they wait until 50 to start screening, have a much higher mortality rate from breast cancer. So the estimates are that this could prevent up to 20% of breast cancer deaths if we implement these new guidelines and people adhere to them. Breast cancer is the #2 leading cause of death, cancer death for women behind only lung cancer.
You mentioned it. The report says starting at age 40 is specifically more important for Black women. Dive into that a little bit. Expand upon that.
Well, we saw this also with men in prostate cancer. Unfortunately, people of color, and particularly Black people, have higher rates of cancer and they're diagnosed later. So this is important that we emphasize early screening to everyone, because everyone's showing higher rates of early cancer. But again, particularly for Black people, this is going to save lives.
Also making news, as you very well know, the COVID emergency now officially over in the United States. That means changes in who pays for vaccines and COVID tests. What's the impact of this move, and does it really mean COVID is over?
Well, it absolutely doesn't mean COVID is over, but we can't continue emergency authorities forever. And that's what this is really about. It's about the emergency authorities that the government has to spend extra money without congressional approval, to waive cost sharing. And so people are going to have to now start paying for testing. Some people will have to pay for treatments, for COVID treatments, if they get sick. Important to remember that vaccines for most people are still going to be available without any cost sharing, meaning they're going to be available for free. One more important point, the CDC no longer can compel states to report data, so it's going to be harder to see the next surge that comes our way. A lot of change is coming, and it means it's all the more important that we take personal measures to protect ourselves by getting vaccinated. And particularly if you're symptomatic, make sure you get tested and get treated with Paxlovid if you do test positive.
I want to follow up on that CDC point. How concerned are you that that data won't be shared?
Well, I actually am very concerned, because one of the big problems throughout the pandemic was that we were driving the car down the road at night with no headlights on and reacting after we hit a bump. Data collection improved significantly when we declared a public health emergency, and we were able to use those authorities to compel hospitals and places doing testing to report. That's going to go away. And like I said, we're going to be driving the car down the road blind again and hoping for the best.
All right. Well, hopefully, yeah, we'll keep our fingers crossed and see what happens. One final question before I let you go. We talked earlier in the show that State Health Commissioner Dr. Chris Box is retiring. She was the face of the COVID response here in Indiana, and I wanted to get your take on her time serving Indiana and your time working with her, sir.
Well, I talked to her earlier today. Her retirement is well-earned and well-deserved. She served during an incredibly tough time. She served during a once-in-a-century pandemic. And she's been in that health commissioner role longer than most people stay in a role like that. A lot of people will remember that she's an OBGYN and spent a lot of her tenure focused on moms and babies and did a really good job lowering the infant mortality rate. But again, was at the helm during the pandemic and did a good job balancing the economy versus protecting people. And unfortunately, she got critics on both sides because of that. But overall, she fared very well, and I'm proud of the work that she did, and I hope she enjoys her retirement.
Couldn't agree more. Dr. Adams, always good to see you, sir. Happy Mother's Day to your wife and your mom, and we'll talk soon.
Same to you and yours. Happy Mother's Day, everyone. And if it's time for a breast cancer screening, then make sure the woman in your life gets that breast cancer screening now at age 40 and up. You're supposed to get it every other year.
Good stuff.